Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, which is quite inconvenient for the study purpose. You can have a continuous study because of that playlist. Anyway, uh, you all know that today also we will going to describe a special topic, and topic for today's class is a very simple one. What are the Ayurveda methods of prevention of nutritional rickets? Now we know that rickets is one of the early infancy disease. As we thought, it is not a late infancy disease, it is an early infancy disease because the epiphyseal ends of the bone, so they start growth in the first 6 months of the life. The growth plate will be formed there. So this will going to happen in the first 6 months of the life. Okay, therefore actually the rickets is considered as a disease of the early infancy. Now of course in the disease we have got different types. Okay, rickets we have got different types. Number one is nutritional ricket and number two is refractory rickets. Refractory rickets is the one which is not responding for the vitamin D supplementation. Nutritional rickets is the one which is responding very well for the nutritional rickets is the one which is responding very well for the vitamin D supplementation. So what we are discussing today is only about the nutritional rickets. Okay, nutritional rickets and not the refractory rickets. Refractory rickets includes many chromosomal problems also and many other enzymatic and harmonic problems also. So that we are not discussing. In case of refractory rickets, even the renal rickets also come. There is an enzyme called there is an enzyme in the renal proximal converted area which is helpful for the production of the vitamin D3. So therefore that's a different issue that we will not cover. Okay, refractory rickets includes multiple organs also. It also includes parathyroid gland. It also includes the rickets. That means renal area. It also includes the liver, etc. Many things are there. But nutritional rickets is purely deficiency of the vitamin D. Okay, purely deficiency of the vitamin D because vitamin D in the way of production it passes through D1 phase, D2 phase, and D3 phase. Finally, what we will get is D3. Okay, and D3 is considered as most active form of the vitamin D, and it is just like a hormone, which is very important for the absorption of the calcium. Okay, so once the calcium is not there, then the growth plate of the bone is not formed in the infant, and that leads to softening of the bones and that leads to ricketic manifestations. That's all. Okay, and more than that, vitamin D is important to maintain the calcium level in the blood also. So if the calcium level in the blood is not maintained, then there will be a problem related to the phosphorus, and calcium phosphorus ratio will be get affected, and the parathyroid hormone will come into play. So many things will happen, so that we will not discuss. But today we only discuss about the Ayurveda understanding in the prevention of the nutritional rickets. Now the main thing is we know that the breast milk is deficient in vitamin D. Okay, breast milk contains a small amount of the vitamin D, or maybe it is deficient. But vitamin D is very important, especially D3 form, which is readily available in the breast milk, whatever small amount which is available. Of course, vitamin D3 not available in excess, or you can consider it's not at all available. Okay, so D3 form is very important for the D3 form is considered as the active form. So now vitamin D is almost all absent in the breast milk, and we always advise exclusive breastfeeding for the baby for the first 6 months. Okay, so one thing is very sure that baby is not getting vitamin D3 or vitamin D. Okay, now we should find some alternate ways by which the body can get the vitamin D. Okay, so now as far as the nutritional ricket is concerned, dehydrocholesterol and as well as ergosterol. So these are the two precursors of vitamin D3. In the dehydrocholesterol is available in the food supplements or diet which we are taking, whereas ergosterol is deposited in between the skin layers. Okay, in the subcutaneous layer of the skin. Now that dehydrocholesterol, so that is only available in the diet for the newborn baby or infant. It is nothing but the breast milk. So it is not available to the baby if you are going for exclusive breastfeeding. If you are going for exclusive breastfeeding. So another way is only is the ergosterol which is present in between the skin layers has to be get activated, and the activated form of this ergosterol also leads to the formation of vitamin D. But this activation is possible only when there is fall of sunlight on the skin. That also sunlight has to fall in a particular wavelength, okay, nearing to the ultraviolet range. Then only it is possible to activate the dehydrocholesterol which is deposited beneath the skin. Now, how Ayurveda plans this, especially for a newborn baby or early infant baby? Okay, the number one is the construction of the Sutikagara. Now, sun rays plays a very crucial role here. Okay, so we also say that a newborn should be exposed continuously. That means regularly baby has to be exposed to the sunlight for at least 20 minutes per day. 12 to 20 minutes per day. So this is what is given in the book. Now, what Ayurveda take care is, number one is we will start from the beginning in the Sutikagara. So when we advise the construction of Sutikagara, the Sutikagara should be constructed in such a way that there should be entry of enough light rays into the Sutikagara. Especially they says that from the Purvadik, it should be facing Purvadik. From the Purvadik itself, the sun rays should fall on the Sutikagara. Okay, so Purva direction, or you can say east direction. Now we know that sunrise takes from the east side, Purvadik, the sunrise takes place, and during the time of the sunrise, the rays of the sun have some ultraviolet range quality, not exactly ultraviolet rays quality. Okay, we know that at the sunset and also at the sunrise, the sun rays which are emerging out, emitted out, so they are having almost a closer proximity with the ultraviolet range. So number one, so when you construct a Sutikagara in such a way that this sun rays, the rays coming during the time of the sunrise directly follow the Sutikagara, so definitely the baby which was kept inside will be also get benefited. Okay, this is one idea. Number two is even the construction of the Kumaradhara. They say the same thing even in the construction of the Kumaradhara also. Kumaradhara is a place where after the birth the child will be kept. Okay, so there also it is told that enough sunlight and illumination should be there, enough sunlight should enter inside the room where the baby is kept, baby has been kept, and similarly it should be also facing Purvadik. In almost all in Hindu religious book, if you say, so they always says that you have to do your any religious work or any other work by facing to the Purvadik or east direction. So this is second important thing, that is about the Kumaragara. Now third one is Surya Rashmi. Surya Rashmi Chikitsa is also explained in Ayurveda. Especially this is mentioned in Atharvaveda, where they mention that Uditam Suryam Krimin Hanti. Okay, that means the rising sun has so many best benefits. So one of them is it is best for the Kamala, it is best for the Rudroga, and it is also best for the skin disorders. Like that they have mentioned. Okay, so this sunlight during the time of sunrise, okay, so that is quite beneficial in many of the disorders according to them. Okay, commonly what we are nowadays using is in the physiological jaundice. So when the child is having physiological jaundice, also baby is exposed to Kamala, also they have mentioned. Okay, in the Atharvaveda Kamala is also mentioned. So when in physiological jaundice, when we expose the baby to the morning sunlight, the ultraviolet range of sun rays falls on the skin, and they have got the capacity of converting the toxic unconjugated bilirubin into water soluble non-toxic conjugated product called as lumirubin. Okay, so which can be get excreted, and the physiological jaundice will come down earlier. That means faster. Okay, so that's the idea. So here also they mentioned to expose the baby to the sunlight. Now along with that, if you expose to the sunlight, that is also one of the stimulation, just like in Sutikagara, Kumaradhara, here also sunlight when falls on the skin of the baby, it is also the stimulation for the ergosterol which is present beneath the skin, and activation of the ergosterol takes place and formation of the vitamin D3 begin. Okay, as mother's milk containing less amount or no amount of vitamin D, subsequent alternative method of creating vitamin D3 is very important, and that was done by this method. But most important among all these things is the most scientific knowledge which is given by Ayurveda is through the Suryodaya Darshana Samskar. Actually, Suryodaya Darshana Samskara should be conducted at 1 month. After the completion of the 1 month of newborn's life, so when the newborn is 1 month old, then you have to do this Suryodaya Darshana Samskara. Now, thing has to be observed here is, it is not Surya Darshana Samskara, Suryodaya Darshana Samskara. That means again, at the time of the Suryodaya or sunrise, the rays which are coming out, so they are having more ultraviolet range. And these ultraviolet range rays, when fall on the skin, so they will activate the algastrol which is present there, and then it leads to the formation of the vitamin D, irrespective of the diet. That means in the diet the vitamin D is present or not, but another way of production of vitamin D in the body is through the sun rays. Now in Suryodarshana Samskara it is told that classically it is mentioned, religiously also it is mentioned. Religiously it is told that when the baby completes 1 month, then it has to be brought out by doing all the religious performance and all. Then the maternal uncle has to bring the baby to the outside and show the baby to the skin, show the baby to the sun. Now, actually it is not a one-time samskara. Okay, only only one day you are performing this samskara, then keeping the baby daily inside the home. It is not like that. This is the starting point. Starting from 1 month, daily for some time, at least 10 to 20 minutes, you have to expose the baby to the morning sunlight. This is the message of this samskara. Everybody will take this samskara in another way, that one day you perform this samskara, then keep quiet. No, it's not like that. This is a message for you that from today onwards you have to show your baby to the sunlight, because the formation of the growth plate begins now. Formation of the growth plate, the process will going to begin now. That requires lot of amount of calcium and as well as phosphorus. For that, vitamin D is very important, and your breast milk which you are giving is not having sufficient amount of vitamin D, and therefore you have to go for the alternate method. So make the baby exposed to the sunlight, so that another pathway of production of vitamin D3 begin. So this message is there in the Suryodaya Darshana Samskara. It is not in the midday sun. It is Suryodaya or to the maximum Suryasta. Both the times you are having sun rays which is very near to the ultraviolet range. Okay, now you can ask, sir, you are telling that ricket is a disease of early infancy. Yes, basically it is a disease of early infancy because formation of the growth plates start from 1 month onwards. Okay, once the growth plates are normally formed, then only you will find proper formation of the bones. Now, usually the bones are soft if vitamin D is not available, calcium is not available. But till the baby start walking, as a parents we are not able to appreciate that bending of the bones, because when weight fall on that, then only you come to know that yes, something is wrong because the child is having bending. But see, only after 1 year baby start walking, the weight bearing starts only after walking. So by the time baby start walking, already the bony changes has been taken place and bone is already soft, and as the weight bearing starts, there will be development of the different deformities of the bone. Okay, by that time nutritional rickets has been already occurred. You can't prevent it. You cannot prevent it. So to prevent it from the beginning itself, you have to follow these methods. Okay, see, usually even for the rickets also we will go for wrist x-ray, because we will not go for any other the lower limb x-rays, because there is no much changes occurred. Although pathology is going on, changes occur because there is no weight bearing. But if you look into the hands, okay, wrist and all, from 6 months onwards, baby when start crawling or you say creeping, then sitting with support, baby uses the palm and the wrist portion, and already pressure has been there, and some of the changes would have already taken place in the bones, and that can be appreciated to the x-rays. Therefore, always we go for a wrist joint x-ray to see the ricketic changes. But later onwards you can go further. But unfortunately, by the time of 1 year, already the changes has been taken place, and you cannot do much there. Already the deformity has taken place. But if you follow these methods, then definitely you will be in a position to prevent nutritional rickets. I am again telling nutritional rickets, not the refractory rickets, nutritional rickets, and which is very common. And you can save your baby from so many deformities. So these are the hidden secrets and some of the golden pearls which is explained in our science, and what a natural method of prevention of rickets. You need not to go for any vitamin D supplements here if you follow these methods. Okay, you need not to go for that. And so this is all for today. Sutikagara method, Kumaragara method, Surya Rashmi Chikitsa and Suryodarshan Samskara are very beautifully explained as a preventive measures for nutritional rickets. But one point I want to want to make clear that about the dark complexion of the data. Now, if you see in Ayurveda, so they says that the breast milk which is produced from a mother who is having dark complexion of the skin is considered as best. And even when they advise the animal milk also, the cow's milk of a dark complexion or black color cow is always best. Okay, we don't know exactly what is the reason behind it, why they have selected the Shama Varuna or dark color. Okay, dark color. And one thing is very clear, those who are having dark color, okay, so they have got excess production of the melanin in their body because melanin pigmentation is more, hence the dark complexion is more, that we know. And this melanin has got produced the melanin, basically the melanocyte producing hormone, so they are produced from the pineal gland which is present in the brain, and pineal gland is also related to the production of the serotonin hormone, and so many other hormones are produced from, and it's responsible for maintenance of biological rhythm also. And some of the researchers says that melanin has got some direct relationship with the vitamin D production. Okay, some of the studies are available. Melanin is the product. Melanin has the amount of the melanin has got some direct relationship with the vitamin D production. Of course, the details are not available. This question is left to you, and whatever I am telling is not even authentication. Okay, authoritative knowledge. So somewhere I have heard about this and read about this, but it is not, cannot be, may not be an authentic source. Anyway, this question is left to you for the thinking purpose. Okay, so you keep on thinking on it. But the first four, so they are definitely the Ayurveda method of prevention of nutritional rickets. Thank you very much. Again, we will meet in another class with another topic. Thank you very much.